Hello everyone, my name is Dr. Justin Hill. We're going to go through plantar fasciitis and heel pain today, new information on causes and treatment. I'm going to assume most of you that are listening to this have had some sort of heel pain or foot pain, and you've tried some different stretches or some different treatments and it didn't work. You may have been told that you're looking towards having to get surgery. What I'm going to go through today is what can be done to prevent that surgery, and also some of the new information about what actually causes this, because it really helps in treatment. So here we go. Who am I? I'm a chiropractor. I specialize in treating running athletes among other athletes. I graduated from Logan University back in April 2009. I've been in practice for about 10 years. What are we going to learn today? We're going to learn what really causes heel pain. We're going to learn the different types or diagnoses and how to differentiate between the different types of heel pain. This is part of the reason why a lot of people will struggle with heel pain, is because you're misdiagnosed. We're going to tell you, I'm going to go through the new research about heel pain, and then we're going to go through the best ways to strengthen, to reduce, and prevent heel pain, and also the different treatments based on the condition that you have. So what's not recognized completely in treating these conditions is that there are different types of heel pain, and pain can present in the same place but be caused by different things. And so here's some of the main ones we're going to go through. Plantar fasciitis, you can have a nerve entrapment at the heel, two different ones. And once again, we're going to go through all these individually. You can have the actual spur on the heel that gets blamed for a lot of the pain. It's actually not usually a pain generator, but it can be. You can have a stress fracture in the heel, and then there's autoimmune diseases that can cause pain at the heel. And we won't go through that because that's not something I can help you with. So plantar fasciitis. So this is the most common for sure. This is the most common thing that I see in my office that causes heel pain. The pain is usually right on the heel or just medial or inside into the heel. It's when the plantar fascia, which connects to the heel and goes down to your toes, is overstretched for just a long period of time. And everybody's different on what that looks like. You don't have to be a running athlete to have this. You can just be a normal person that's not really doing anything athletically. You can still have this happen. The biggest issue with this is typically getting out of bed in the morning and taking the first few steps. And it's usually when you toe off. So when you're up on your toe, that's when you're really going to feel it. And that's important because it's a differentiator between other types of heel pain. There is a medial nerve entrapment. Now, I've actually had this happen to me before, and I actually had to I went through months of it not improving, and then I had this when I was in chiropractic school, and a kind of a mentor student of mine was doing an internship, and the doctor that he interned with figured it out, and he came over to my place and went through some of the testing, and we figured it out, and it was fixed within a week or two by doing the right stretching. The pain on this one is a little bit more into the arch, so not so much right at the heel, a little more into the arch. Pronation tends to be the cause of this one, where with plantar fasciitis, pronation is not typically a cause of it, and that's some of the new info that we're going to go through a little bit here in a few slides. Baxter's neuropathy is a nerve entrapment that's more at the heel versus so much into the arch. And so the pain is going to be a very similar location. You can see that's where the nerve is. This is the heel right here. I know this picture isn't fantastic. This is the medial plantar nerve. This is the inside of your foot over here. This is the outside. This nerve branches off and goes right to the front of the heel. What's important is that if you treat the local tissues right at the heel with this particular condition, this one will not improve or very mildly improve. And then of course, you'll want to do surgery or things like that, and it's usually unnecessary. There are nerve stretching that you can do for this particular nerve entrapment, along with the previous one, the medial plantar nerve entrapment. And one of the big ways to differentiate this one is that this nerve will help you move your baby toe outwards, and if that's really difficult for you to do, this can be a main player. Heel spur syndrome is when the spur that can form on the heel actually is causing the pain. And how do we differentiate this between plantar fasciitis? Well, in this one, typically when you toe off with walking, it's not going to be a big deal. It's going to be more when you heel strike, so when your foot hits the ground, because you're pushing right on that heel spur. So that's the main difference with this one versus the other ones that can cause heel pain. One of the better treatments for this particular problem is you really got to do some cushioning in the heel to prevent this heel spur from being irritated. You don't have to go in there and surgically remove it. That usually doesn't help you very much. You just usually have to make the heel spur not hurt. And there's some local treatments manually that you can do to help this as well. But the cushioning can make the biggest difference. Calcaneal stress fracture is when you can see a little bit of a fracture here. Usually it's actually going to be along the heel here a little bit more. This is differentiated through a simple test of holding the heel in between your pointer finger and your thumb, and you just squeeze the heel, and you'll reproduce this symptom. And it'll be the most positive test versus some of the other testing that you can do to differentiate. In this situation, rest is usually the best idea, and cushioning is usually the best idea. I don't see this very often. This is pretty rare, but you want to rule it out because, once again, if this is going on, this is one that's not going to get better with manual treatments to the plantar fascia and some of the other things that you have to do to treat heel pain, and you want to make sure you're doing the right thing right away. As I said earlier, there are autoimmune diseases that cause heel pain. We're going to focus on the musculoskeletal component of this because autoimmune diseases are obviously treated differently. What's the new research showing about heel pain? Well, what we've come to find out is that the main issue that has been thought of for heel pain for a long time is that overpronation, or when your foot comes down towards the ground. And overdoing that will stress the plantar fascia and it'll cause heel pain. Actually, that's not true. The two biggest factors in the research that's come out in the last few years shows that lack of ankle dorsiflexion, which is the leg moving over the ankle forwardly, and weakness in these lateral leg muscles, or the peroneal muscles that you can see in this picture, those two have been correlated the most with heel pain, regardless of the type of heel pain. And so it's really important to know this because if we do the proper rehabilitation, we can usually prevent this from coming back and actually fix it more quickly. So now that you know more about what causes heel pain, you know that there's a lot of different types of heel pain. Okay, so what do you do with this information? Well, first and foremost, you got to make an accurate diagnosis. And you want to know, is it plantar fasciitis? Do we need to treat the plantar fascia? Do we need to treat the nerve entrapments with nerve stretching? What's the big thing going on? And once we diagnose that, which once again, that's very simple to do with orthopedic testing and some functional or movement testing in the office. We don't need fancy MRIs. We don't need fancy ultrasounds or X-rays, things like that. If a patient becomes a non-responder after 4 to 6 treatments in my office, then I'll sometimes spring for that imaging just to make sure that we don't have a stress fracture or something like that, even if the testing was negative for that. But all in all, usually the advanced imaging is not that important. It finds a lot of false positives. So if we diagnose plantar fasciitis, what do you need to do? Well, to treat the pain, you got to use myofascial treatments on the bottom of the foot into where the plantar fascia runs, and especially at the heel. I tend to use what's called ART, and I tend to use a steel tool that's called instrument-assisted soft tissue mobilization. These things tend to work really great for treating the plantar fascia to get it to stop hurting. We want to almost always, we have to mobilize the ankle with dorsiflexion, with manipulation, and we need to treat the calf muscles because they're also going to restrict dorsiflexion, preventing that mobility, which puts the extra stress on the tissues around the heel. And I like to use chiropractic manipulation. Of course, I'm a chiropractor. There's many ways to do it, but I find that way to be great to get the ankle moving. And then, of course, I still use this similar myofascial treatments. I will also use a dry needling technique with acupuncture needles into the calf to really relax that tissue. And then, of course, we use the proper exercises at home. If we have the nerve entrapments, there's a very special nerve stretching and nerve mobilizations that you need to use that really help treat those nerve entrapments and get them to feel better much more quickly. If you don't use those, you're going to fail on those treatments. And then if you've got fat pad syndrome or heel spur syndrome, you want to use cushioning in the heel. A simple one, you can go to a sporting goods store and buy a $15, $20 heel cushion, and that can really make a big difference for those particular diagnoses. And that's why it's so important to get the right diagnosis for heel pain. Not everything is plantar fasciitis, and if you don't do the right things, you won't get these people better fast. New exercise protocol must be used for these patients. This is a big thing the research has shown. We have to specifically work those lateral lower leg muscles, the peroneals, and we have to work the foot intrinsic muscles. The foot intrinsic muscles, which are the muscles in the bottom of the foot, they unload the plantar fascia. And so when those muscles aren't working correctly, then the plantar fascia takes all the load when you're just normally moving around, walking, running, whatever, and they will, eventually the tissue will fail and cause that pain. So this is how we rehab and correctly not only treat the pain now, but prevent it in the future by this strengthening. There's a few really simple ones you've got to do that really target them. There's a leaning forward exercise, there's a bear position exercise, and then there's a heel raise modification that we can go through. And I'm going to have I have these exercises posted on my website, and you guys can find them. They'll be labeled just like this. That way you can see what I'm talking about. These types of exercises are typically done either isometrically, where the muscles themselves aren't necessarily lengthening or shortening, but you're contracting them. And usually you want them in their lengthened position, and then you contract them. That's how you get the most contraction with those muscles. And once again, the videos of these are going to be important. I'm going to go through these exercises now, but the videos are going to be important. When you do the lean forward exercise, you're going to stand close to a wall. It's usually about 6 inches. You want to flex your knees slightly. You kind of externally rotate your hips. When you do that, you're going to feel your arch in your foot come up, which is what you want, even though your toes are still going to be down. So you're going to hold that position, keeping your heels down and your toes down, and then you're going to lean forward like you're going to touch your nose to the wall. What you're going to feel is your toes will grab. You'll feel the muscles in your feet work too, and you'll do one set of 20 reps, and you want to do that 2-3 times a day. And that's a great way to get started strengthening those muscles. The modified toe raise is the progression from the leaning forward. Most people have done a toe raise, but they didn't do it correctly. They didn't get up on their toes. They kind of got up on the ball of their foot. So it's the same starting position where you're close to the wall, your knees are flexed, you externally rotate your hips so your arches come up. You're going to lean forward till your toes grab the ground, and then you're going to come up onto your toes, and you got to get up on your toes. This is going to be pretty difficult for most people, and it's a difficult exercise to balance on, so that's why you want to be close to the wall, so if you move or fall, you can kind of grab the wall. Once again, do 20 reps, do one set. The key to this one is to grip with your toes and keep your legs in that external rotation. This is the one that's going to get your peroneal muscles activated and really working. Bear position modification, this is a little bit of a tricky one, but I like this one because it brings in the whole system of core stabilization and other areas of your body that need to be stabilized to kind of put everything together. You can read through this one. This is a good video one, which once again I'll have on my website. If you're doing these exercises and you're cramping and you feel that cramp in the arch of your foot, that's okay. Just means those muscles are weak and they need to be strengthened. What you do is you just reduce the total number of reps until you start to tolerate it more. If you have any questions, this is where you can reach out to me through either social media, you can reach out to me through email. All that information is on the next page. The article that I really went through, you can see here. I know the picture isn't perfect, but if you go to humanlocomotion.org, this is Dr. Tom Michaud. I was very fortunate to do a seminar with him last year, and where he went through a lot of this new information, and it was really great. And then here's my contact information. I'm a chiropractor. That you can see my office is Sunset Hills Spine and Joint Center. We're in Sunset Hills, right at Gravois and Lindbergh. You can see my website. It's not spelled correctly, so I'll have to go in and fix that. You got my email right here, so feel free to email me anytime. And you can find me on Instagram and Facebook. And feel free to follow me and reach out to me and let me know if you guys are struggling with heel pain or plantar fasciitis, or you want to know more about, if you want to exam and find out more, absolutely call. You can see my numbers right here from my office. You'll speak with Teresa. She's my assistant, and schedule an appointment. We accept all the major medical insurances. We'll get that. We can usually get that checked the very first day. You'll know exactly what any costs will be right then and there. And usually by the time you leave that day, you'll know exactly what's going on, which type of heel pain you have, and what the game plan is to fix it. And I'll be very upfront with you and tell you everything that I can the first day. And there shouldn't be any surprises with moving forward with any treatment that we need to do. And if you're not a good candidate and I don't think I'm going to help you, I'll let you know right then and there. And we can move forward from there. So thanks for spending this time with me. I hope you learned something. And as I said, feel free to reach out to me anytime. And have a great day.